Assalamualaikum and hello to everyone. I am Nazira Johar. Today I am going to deliver a lecture on the topic of medical negligence. Negligence is a broad area. It can occur in every discipline of our life. As we are in the medical field, so we call it medical negligence. Medical negligence includes all claims that arise from the negligence done by the healthcare providers, nurses, doctors, medical assistants, dentists, and etc. Litigation, or the process of taking legal action, has started to grow since more than 15 years ago. People are looking for compensation for the damages occurred to them as a result of negligence done by the healthcare providers. The rise of the litigation cases may be due to the loss of income because of the permanent disabilities that the plaintiff experienced, or they just want to take it as a lesson that should be learned by the healthcare provider for not doing the same negligence in the future. In Malaysia, we also faces the increased number of incidents related to medical negligence. Cases such as wrong surgery, unintended retention of foreign objects, transfusion and medication errors, and patient falls had shown the double increment between 2016 and 2018. According to the previous Minister of Health of Malaysia, safety failure will lead to the loss of trust in health systems and in governments. Furthermore, the minister also told that approximately 15% of hospital expenditure and activity in the Organization for Economic Cooperation and Development member countries was linked to safety failures. For the introduction, we should understand that if we do not practice our nursing skill according to the standard of care, we will risk our patient. If harm has occurred to a patient, then the patient or his or her representative can seek compensation. But there are certain elements that should be proved before they could win the claims. Not all harms is compensable. Some of the harms may arise from the side effects of the procedures or of the treatment, and it may come also from a common risk that may occur in certain procedures such as surgery. The risk for the surgery will be informed by the doctors prior to the surgery. Accidents to patients are infinite. They include incidents where the patient fall out of bed, pressure sore develop, the wrong dose of medicine given, the wrong limb amputated, the treatment is given to the wrong patient, the patient dies as the result of mistakes, and etc. What is negligence? According to Berman and Sinder, negligence is a non-intentional thought. We have learned about the thought law before. Negligence occurs when the nurse fails to follow established policies, procedures, and standard of care in the same manner that another reasonable nurse would do in the same situation. There are 4 elements in an action for negligence. We will go to the next slide for further explanation. These 4 elements is very important in the case of negligence claims. The plaintiff, either the patient, herself or himself, or the representative, are required to prove to the court that this element was occurred. In this lecture, I will explain to you each of the elements by giving some example for you to understand better. The first element is the duty of care. The plaintiff should prove that the defendant, which the nurse or the healthcare providers, owed the plaintiff a specific duty. We can use either the term duty of care or standard of care interchangeably, but the standard of care is more specific to a nurse. The second element is breach of duty. Breach of duty that the behavior or inaction of the defendant in the circumstances did not meet the standard of care which a reasonable person would meet in the circumstances. the breach of duty caused the harm, that the damage was caused by the breach of duty. Number 4, the plaintiff was harmed, that the plaintiff has suffered injury or loss which a reasonable person in the circumstances could have been expected to foresee, to predict, or to anticipate of the damage. We will go one by one to the element of negligence that needs to be proved by the plaintiff. The first one is a duty of care. The defendant owed the plaintiff a specific duty, means the standard of care. Standard of care is the standard to which nurses are compared when accused of negligence. The question that will be asked is, what would a reasonably competent practitioner of nursing have done given the same situation? Duty of care. In medical negligence claims, duty is dependent upon the existence of a provider-patient relationship. When a healthcare provider consents to treat a patient, it becomes the healthcare provider's duty to use reasonable care and diligence in the exercise of skill and the application of learning to accomplish the purpose for which the healthcare provider was employed. Let's have a look to the first example. During nasogastric insertion, a nurse will insert a thin plastic tube through the patient nostril, down the esophagus and into the stomach. Once this tube is in place, the nurse needs to perform a few tests to ensure that the tube is in place before can use it to give food and medicine. The plaintiff needs to prove that the nurse is not following the standard of care before taking any legal action. The plaintiff will refer to the standard of care for nasogastric insertion. For example, in a hospital, every department or nursing area should have a manual procedure for every nursing practices related to their discipline or working areas for their staff to refer. As a nursing student, you have a manual procedure provided by the school. So, if negligence occurred, the plaintiff representative, which is normally a lawyer, will have a look of the standard of care and find ways to prove that the nurse does not follow the standard of care. That is why every time we want to perform a procedure, make sure that we do it in a proper way, no shortcut, not following other nurses just because of they are seniors. We should gain the skills during the student time, practice the correct one for the whole, and practice the correct one for the whole of your life. Example number 2. Before administering medication to a patient, a nurse should perform the 6 rites, which include right patient, right drug, right time, right route, right dose, and right documentation. What will happen if the nurse did not check for the patient's name properly? Again, we have to look for a correct practice of giving medication. Few years ago, there were only 5 rites that should be followed, but recently, the rites has increased to 6. It shows that the knowledge and practice is keep changing and improving. We should also look for the best practice according to the current research. We may suggest to the management at our organization if we find the best practice based on the evidence. The second element of negligence that need to be proved by the plaintiff is breach of duty. The defendant breached this duty. Breach of duty is that the behavior or inaction of the defendant in the circumstances did not meet the standard of care which a reasonable person would meet in the circumstances. What is breach of duty? According to Icahn et al. 2019, breach of duty is often referred to a liability or a deviation from standard of care. The standard of care is the degree of skill, care and judgment a reasonable, prudent, similar healthcare professional would have exercised in similar circumstances. The healthcare professionals are not required to deliver the highest degree of care possible, but they are expected to deliver standard of care. For better understanding regarding this matter, we will see two examples. Example number 1. During a nasogastric feeding procedure, a nurse gave 150 ml of milk to an unconscious patient without performing the test to confirm that the tube is inside the stomach, because she was in a hurry and forgot to do so. The patient's vital signs deteriorated due to the pulmonary aspiration. Did the nurse breach the standard of care? Yes. The nurse should perform 3 tests before start to give the milk. The test will provide evidence that the end of the tube is inside the stomach and not misplaced to the larynx or inside the respiratory system. Pulmonary aspiration means the milk has entered the larynx and the respiratory system. Can the patient die from the aspiration? Yes, there are possibilities that the patient could die due to aspiration pneumonia, especially in elderly. Example number 2. During the administration of an oral medication, a nurse gave a woman a medication that did not prescribed by the doctor. The incident occurred because the nurse was asked by her colleague to give the medication and she just took the medication and gave it to the patient. What should the nurse do before giving the medication to the patient? In the first place, are we encouraged to implement such practice? Do you still remember in the previous slide, the previous Minister of Health in Malaysia have mentioned that the incidence of medication errors was increased. This is one of the examples of practice that could lead to the medication error.